ang awit ng Pilipinas.
Kayang magiliw, helas ng sinakanan, alam ng puso, sa titik mo'y buhay. Lupang hinirang, kuya ka ng magiting, sa manlulupin, di ka pasisingin, sa dagatang tutok sa simoy at sa langit mong pagaw, ay hinatang tulad, awit sa pagkayang minamahal. Ang isang ng matawad mo'y tagumpay na nagtitindig, ang bituin at araw niya kailan pang ay di magtitindig. Luman ang araw ng walhaging pagsinta, buhay langit sa piling mo. Aming ligaya ng pagkay mga amin, at mamatay ng dahil sa'yo.
This country has faced so many problems since the start of 2020. So why AgriPortal? 1. To solve our food problem. Our government's poor management of farm produce have resulted in either oversupply that leads to wastage, or undersupply that leads to skyrocket farm prices. With special thanks to these greedy middlemen, we have a problem. Our solution: we will bring the market to the farm, through project harvests. We will connect the buyers, processors, and end users to farmers' communities. To solve our present food problem. 2. To transform the mindsets of our farmers and less fortunate Filipinos. Presently, we live with a wrong mindset. This is the main reason why farmers continue to live below poverty line. They do not know their basic ABC, attitude, behavior, and character. Our solution: our Stewardship Quotient program is designed to transform our stakeholders and farm communities. Morally, behaviorally, financially. 3. To motivate the youth and women to get involved. Presently, our youth and women are neglected, while our farmers are getting old. Our solution: let us empower our youth and women to get involved in agriculture, environment, ecotourism, and agribusiness. Women in agriculture surpasses the men. Let us equip our youth, for they are the hope of our future. 4. To form faith-based communities to become agri-enterprises. Because of agrarian reforms, farmers are fragmented and vulnerable to abuses of the rich merchants. Our solution: we shall incubate faith-based farmer communities and faith-based investor communities, then design pilot projects for them, to become independent agri-enterprises of various sizes and capacities, supported by featured services of AgriPortal, for them to thrive and grow, that one day soon, they will achieve their dreams and aspirations. 5. To resurrect agriculture and make money. Our solution: as we solve the food problem, educate and change the mindset of Filipinos, empower the women and the youth, and forming faith-based communities to become agri-enterprises all over the provinces. This would guarantee not only a resurrection, but a genuine transformation of our hearts of the nation. As we look forward seeing our vision fulfilled and completing our mission, reaping the benefits of transformed hearts of the nation, as our stakeholders become true stewards of God's resources, prosperous families bound by love, productive and inclusive communities, a blessed and fruitful nation, blessing to all nations. Let's work together to make this noble advocacy a reality. For our children and for future generations. AgriPortal, transformation in the hearts of the nation. Thank you for watching.
I'd like to thank everyone for your precious time to be here. And I would also would like to thank AgriPortal for being the host this afternoon, as well as my fellow Lions from District 3183 We are doing this to serve our fellow brothers and sisters. And I would like to say roar to all of us this afternoon. I would like also to thank my family members in the Ching Family Association. Their support is valuable that they are here to learn from from about this COVID-19, about this Omicron, and also my fellow brothers in the industry, the Federation of Electrical and Electronic Suppliers and Manufacturers of the Philippines, of PESA, which I am. And also, I would like to thank BuCor Lab Foundation Incorporated, the Aftercare Office. This is a foundation that that serves our people deprived of liberty, or PDLs, especially those who are already out of prison, helping them to start a new life. So also to continue, I would like to take this opportunity to introduce the speaker for tonight, for this afternoon. She is none other than Dr. Jennie Wong. She is a pediatrician by practice, but today she had handled thousands and thousands of COVID patients. That includes those who were hospitalized, and I pray that there are none right now, as well as a lot of them who are under home care. She is connected with the Fidel Mundo Medical Center, and as well as the pamantasan ng lungsod ng Manila, Hospital ng Manila Medical Center, as well as Chinese General Medical Center and the Cardinal Santos Medical Center. She is a graduate of FEU for her Doctor of Medicine, and also took her Master's in Public Health Institute of Community and Family Health at the Fidel Mundo Medical Center in Manila. She took her postgraduate diploma, a master's in clinical research. So basically, she's a researcher from University of Liverpool in United Kingdom. Master's in hospital management and master's in business administration at Jose Rizal University in Mandaluyong. And as well as from Boston University and Stanford University, she took a course on pediatric nutrition. Without much further ado, let us invite Dr. Jennie Wong to take the window for us.
Thank you for that kind introduction, and I'm very happy to be with all of you today. We have AgriPortal PH, we have BuCor Love Foundation, the International Lions Club 301 district, and then the Ching Family Association also, as well as the PESA. So I'm very happy to be with you this afternoon. Unfortunately, the internet seems to be having difficulties, no, this afternoon, maybe because there's a lot of people on the net right now. But we'll try to do this hopefully smoothly. So let me share my slides. So good afternoon. I'm happy to be with you today. This afternoon, I'll be talking about practical tips for home and workplace, COVID-19 prevention, diagnosis, home care management amidst the possible Omicron surge. So for my disclosure, I am a member of the Speakers Bureau of Pfizer Vaccines Philippines. So some of my objectives, to share with you a quick scenario of the COVID scenario in our country, and to share with you some practical tips you could use for personal safety and also for the safety of your workplace, your offices, as well as to share some home care management tips. So into our COVID pandemic, we're going on a third year already. So we started on March 15. I remember distinctly, it was right after my birthday. March 8 kasi birthday ko. So right after we already had our major lockdown in Manila. So during March 15 of year 2019. So it's gonna be roughly going into third year already. So for coronavirus, how long have they actually existed? The most recent common ancestor, MRCA, we call, of all coronaviruses is estimated to have existed as recently as 8,000 BC. So before Christ pa to, no, 8,000 years before Christ, we already have this virus. It's not something new. Although some models place the common ancestors as far back as 55 million years or more, implying long-term coevolution with bat and avian species. The COVID-19 virus is a new virus linked to the same family of viruses as SARS and some type of common colds. No, that's why I keep on reminding patients and family of my patients to don't forget to get also your routine vaccinations, no, especially your flu vaccines or influenza vaccines, because as you could see, there is some common sharing of common characteristics with the SARS virus as well as the common influenza virus, no, the SARS-CoV-2 or the coronavirus, no. That's why by having your yearly flu vaccines, no, you also get some form of cross antibody protection for your corona viruses. Next, some of our previous pandemics. So how long have they lasted? No, the closest I could find is the Spanish flu, no, which was the 1918 Spanish flu. This pandemic actually lasted from 1918 to 1920. The virus actually moved also from birds to humans, infected an estimated 500 million people worldwide, and this equates to US alone and approximately 50 million worldwide. So how about the COVID-19 disease burden? So for COVID-19 worldwide, you see, it's not as bad as the Spanish flu, probably because of modern medicine already. You know, we have more equipments now. We have more antibiotics that we could use, no, to treat concomitant illnesses and complications, no, and more medical equipments that we could use to treat patients right now compared to during those times. For coronaviruses, all viruses, including SARS-CoV-2, the virus that caused COVID-19 surge, changes over time. Most changes have little or no impact on the virus properties. Some changes may affect the virus properties, such as how easily it spreads. So this mutation, this new variant, which we call Omicron, we see how easily it spreads, no? How very transmissible it is. To give you an idea how easy it spread, during, as Mr. Ching shared, I've been treating COVID home care patients for the last year 2020. That was during the Delta variant. I had 1,070 consults, including 60 children. But just this year alone, starting December 30, right after the Christmas break, no, and the Christmas festivities and all. December 30 to January 4 this year, I already got 700 patients during that time. So my phone was ringing really nonstop 24/7. So that's how easily the Omicron spread, no, in just a few days. Roughly 1 week and more than 700 cases already. That's just my personal data, my personal patients. What more outside, no? So nationwide, so especially in the NCR. So the spread really happened quickly. So there is a rapid upward trend or surge during those time, no, that you could see. The associated disease severity. Luckily for the Omicron, compared to the Delta strain, we saw it is so far, because we're only 1 month into Omicron, the disease seems to be milder, no, than Delta. I'm sure each of you who have family members who experience the Omicron would have seen the difference, no, between the Delta strain and the Omicron. The Delta strain, the disease actually lasted very long. The signs and symptoms of the patients lasted roughly 2 weeks, no? Most of the patients, hindi pala sila fully well after 14 days, no? Sometimes reaching as long as almost a month, no? During that time, it was very hard to treat, especially for elderly population or for seniors, no? But for the Omicron, luckily, the disease seems to be a little bit less severe or milder. Most patients presented with mild symptoms. Probably one of the reason is because the variant is really less pathogenic, which we call causing less severe symptoms. And secondly, because most of the patients are already vaccinated. Most of the general populations already have some immunity in the form of COVID vaccines received already, some even with boosters, no? Or the performance of the vaccines, no? We see that during the Delta strains, a lot of vaccines, although they claim that these vaccines have coverage, no, or give protection for Delta strains, but however, we see some severe cases also during that time. So meaning it doesn't give you that well protection. For Omicron, how was it? Most of the patients who are fully vaccinated, especially those with boosters, have already very, very mild, almost no symptoms. No? Majority nga asymptomatic. They're only incidental finding na mag-travel, no, they're gonna board a plane already at the airport, and then they will call me, doctor, I tested positive. No, so they did not even know that they already have COVID. No, so that's how light the Omicron seems to be, and the effect of the vaccine seems to be working also with the Omicron. So far, what we could say with vaccinations is it really prevents a lot of ICU admissions, a lot of deaths. No, it doesn't guarantee that you won't get COVID. However, it guarantees you might not get the very severe form of COVID, severe complications, severe ICU deaths are more preventable with vaccinations. No? So that's what we could assure patients. In fact, most of the patients in the ICU right now are those patients who are unvaccinated yet, or with incomplete vaccination, meaning just one dose. No? So therapeutic medicines are highly available, and some of the strains are highly responsive to medications. No, this COVID-19 Omicron so far, it seems to be working well with current therapeutics. No, very fast yung immediate relief patients. No, we hope succeeding. Although this does not mean that future strains would or variants, no, would also be the same. We should always be careful na we're not dealing with one variant. We know that Omicron or coronavirus virus will continue to mutate, no, yearly, months after, and soon we're gonna see some new variants, and we don't know how easily it will work with the current vaccines and therapeutic modalities we have now. So wait and see kami always, no. We also don't know what the future holds for us. That's why we're trying to keep everyone protected, and reminding everyone to observe the healthcare protocols, no, which are very important. Diagnostic tools, no, these are the COVID swabs, COVID antigen tests, whereas before we could use saliva kits or saliva test kits with ease. Many people prefer that kasi less painful, no? You don't have to do the nasal swab. However, what we see in the actual practice for the Delta variant and this Omicron variant, no, it's not very highly detectable using those saliva kits. No, so diagnostic tools will matter or will differ according to predominant strain at that time. So right now, the gold standard is still PCR and the nasal swabs, no, or other public health and social measures which we have to continue all throughout the pandemic. So for the COVID-19 updates for our country, the Philippines, so these are some of the data. You could see September 19, this was one of the worst surge we had. This was during Delta strain. And we have almost 20,000 cases, no, reported in the Philippines, mostly in NCR, but we see all the cases of Delta all over the Philippines also. But however, we honestly believe in on the ground, this is much worse, no? The actual count actually went as high as I would predict at that time, almost 30,000 cases a day. However, you see this trend, bumaba siya, no? During November, we almost have none, no COVID calls. I was so happy. The whole month of November, my phone is quiet. And I actually had zero home consults for COVID at that time, no, except for my ordinary patients. However, December 30, as I told you, my phone was starting ringing nonstop. This was again the surge. So this was the 700 cases I was telling you about in just a day. So in a span of 1 week, I suddenly have 70 to 80 families, not patients, families. Each family have around 10 members of the family. From the oldest patient is 98 years old. My youngest patient is a 2 months old and newborn babies. No, so that's how bad the surge was really. And we were really frightened or we were really caught unaware, no, because of what happened. Everybody celebrating Christmas, they got exposed in Christmas parties with families, with associations, and that's how the surge really happens. A lot of people traveled, and when they came back, the whole family already got COVID. So it was really bad. For the NCR and Luzon, Visayas, we had roughly 3 million cases in the Philippines, and we already have 50,000 deaths. No, in fact, in ASEAN countries, Asian countries, we went to the top. No, after the surge, we surged to number one in terms of the numbers of cases in Asia. So right now, a few days ago, we had 37,000, but during this time, my actual estimate for the calls, based on the calls we receive every day, and a lot of, remember, this reported number is only for RT-PCR swabs. They don't report antigen swabs, no? So the DOH don't include in this report the antigen swabs done, home care antigens done, was not reported. So most of the families which we handle in home care, e-consults, do their antigen swabs. No? So roughly, I would estimate it went up to roughly around 50,000 during that time. No, the first 2 weeks of January, and then they declared a level 3 precaution and already started during having restrictions, no, for travel. So that's when the cases started to go down again somewhat. So now we have roughly 31,000 a day. But actual count based on the antigen swabs, I would say roughly mga 35 to 40,000 pa rin to. But what's a good thing is the number of deaths actually went down a bit. Last week, it was at 187 to 147 deaths per day. So even with Omicron, remember, even if the Omicron variant is a bit lighter than the Delta or a bit not so pathogenic, still we see a lot of deaths. Why is that? Because probably people, immunocompromised populations, there are high risk of deaths also. Elderly, no, mga seniors who cannot feed, they die of dehydration, they die of MI, myocardial infarctions. No, so young kids, no, they could also die from severe dehydration, sudden cardiac deaths. So the US CDC has been collaborating with the global public health industry partners to learn about this Omicron that we have. It's something new. It started roughly to rise last November to December. As we continue to monitor its course, we don't know yet how easily it spreads. So far, from what we could see in January, it spreads really fast. The severity of illnesses it causes, so far it's mild, but still we have some deaths, no, probably due to comorbidities or how well available vaccines and medications work against it. So far, we see naman the vaccines and medicine are working pretty well so far. So current vaccines are expected to protect against severe illnesses. I told you it doesn't protect you from getting COVID, but it protects you from getting severe illnesses. Hospitalizations, as I told you, most of my patients right now are fully vaccinated. And out of the 800 cases I'm handling right now for e-consults, 500 are already well. So I would say mga 600 patients are already well. I only have around 200 patients on hand, and all of those patients are managed at home. So they are able to prevent hospitalizations because of the vaccinations, no? And that's due to infection with Omicron variant can be preventable with vaccination also. However, breakthrough infections, what does it mean by breakthrough infections? It means people who are already fully vaccinated are also likely to get the illness or COVID-19 infection. No? So it doesn't guarantee that you get 2 doses, you get boosters, we won't get COVID na. Walang ganung guarantees na. Unfortunately, it doesn't work that way. However, it does protect you from severe infections and ICU admissions. With other variants like Delta, vaccines have remained effective at preventing severe illness, hospitalizations, and death. We're hoping Omicron and the succeeding variants are also protected with the boosters, and the regular vaccinations that we have. The recent emergence of the Omicron further emphasizes the importance of vaccinations and boosters. So what are the signs and symptoms? No? Unfortunately for the Omicron, as I told you, a lot of people, the results came in incidental findings. No? Clearance for work, January 5, the opening ng businesses, the employers ask the employees to go for a swab, and then almost all the employees would turn out to be COVID positive. For our company example, for the more than 50 employees, 5 employees tested positive. So immediately they were sent home and requested for our RT-PCR swab. For another shop, we have 15 employees. We had 2 positive. So again, sent home and requested RT-PCR swab. So that's how important it is to monitor, especially if you see a surge of cases. It's very important to monitor your close-in staff, to keep yourself protected also. So the signs and symptoms could be very, very mild kasi. It could be fever of a day, fever for 1 to 2 days, not even very high grade for adults, low grade fever lang siya, some sore throat, body pains, night headache, night sweats, and abdominal pain and diarrhea. However, what is very notable in Omicron for the patients I handled, severe headache. The patients complained of very severe headaches, severe body pains. So it really make them have difficulty sleeping at night, because of the severe sore throat, severe headache, severe body pains. So that's very notable for Omicron. For children, it's different. For children, the cases I've handled, it's quite a lot. I have a lot of babies and young children right now. The fever could go as high as 3940s, So the mothers started calling me middle of the night, Doctora, in panic. Doctora, the fever is it doesn't go down. The fever is 3940. The baby started to have chills, and seizures already. So the fever is very, very high. So what to do? If you have very, very high fever, you have to bring down the fever. So for both adults and young patients, it's very important to remember when you have fever, mali na yung notion natin before na if you have fever, mangsanghyak, buin, sangyak, do not take a bath. That's already a wrong notion. In fact, we need sponge bath. We call it tepid sponge bath or TSB. For children, you sponge bath the baby from head and neck, whole body until toes. 2 towels, 1 for wet, 1 for dry, 5 times in front, 5 times at the back, whole body. When you say sponge bath, as in sponge talaga siya. no, use the wet cloth, no, wipe it thoroughly, no, talagang with heavy drugs, because that will dissipate the heat. The aim is to release the heat. Do not put ice, do not put alcohol in the water, just use ordinary tap water. Okay, if you cannot do that and you have difficulty, bring the child to the shower area, quick 2 minutes shower, quick bath lang, tapos towel dry. No more soaping, no more shampoo. So that's what I want you to do also for seniors or adults who have very high grade fever. Because if you do that every 1 to 2 hours, then you bring down the temperature to less than 38, there's less chances of seizure. Because if the child develops seizure or chills, lalo sila nataranta. No? So the fever could go very, very high. So for home tips, no, how do you strengthen yourself? How do you protect your homes? First, do not forget the most important thing talaga for all of us is to strengthen our immune system. No, we all know this. However, sometimes we get busy, we forget. No, take your proper load of nutrition. No, foods in the forms of fruits and vegetables, green leafy vegetables. No, they're very high in zinc. They're very high in iron. They give us much immune boosters, no? So malunggay, broccoli, no, some of the good vegetables, no, ampalaya, no, these are very good for immunity, no. So as well as all the green leafy vegetables, no, don't forget to eat that, and fruits, no, and then that will give us vitamin C, kasi. So the natural vitamins we get from food is even better from taking a lot of those vitamin supplements, because not all vitamin supplements could be absorbed by our body, unlike natural foods or fruits. No, so it's very important to remember. Vitamins, multivitamins, zinc, right? Double dose vitamin C with zinc, vitamin D, natural sunlight. No, those will help a lot. Sleep, no, sleep is underrated, no. A lot of people forget we need sleep, especially the teenagers now. They don't sleep enough. You need 8 hours, 6 to 8 hours of sleep a day to maintain a good robust immunity in your body. If you lack sleep, your immune system go down. That's when you're at risk for catching the COVID infections. Exercise, 15 to 20 minutes exercise, any exercise at the home is good enough, no? So it's very helpful also. For vaccinations, no, we cannot hype enough on the importance of COVID vaccinations. All vaccines naman are effective in preventing ICU admissions and severe diseases, no? All vaccines regarding of brands, no? So kahit anong gusto mong brand, it's fine as long as you get 2 shots and 1 booster at least 3 months after. Why am I hyping on boosters also? It's very important, no? Because studies will show the immunity really goes down at 6 months, no? For those who got coronavac, same as us, coronavac is Sinovac, the antibodies were shown to go lower earlier, no? So by 3-4 months, medyo mababa na yung antibodies. That's why we need the booster, no? So remember the booster. For now, we recommend 1 booster only. Follow what the DOH or the health professionals recommend. I don't recommend you to get, some people I know, they got 4 shots already. Some people got even 6 shots, would you believe? But we don't advise that too much, no? Because if you get too much vaccines, we don't know what will happen to your body. It might induce the body to provide to. For now, it's only recommended 1 booster shot, at least 3 months after. Majority of the booster doses could be given at 3 months. For J&J, those who receive J&J, they're eligible to receive a second dose 2 months after. No, any brand available, preferably with J&J, but J&J is not available right now in the market. So if not available right now in the LGUs, they could receive mRNA vaccines also. The mRNA vaccines is Pfizer and Moderna or Astra for viral vector if they have no choice, no J&J available. So for stay out helpers and drivers, we have a lot of those. Um, it's also a risk for our families because syempre they go home to their houses, no, which we cannot keep clean for them. Make sure they always wear masks when they are in your household and remind them to do hand washing always. No? For large households, ito yung problem ko. Most of my e-consult patients, there are people living with very, very large households, no? With 3 or 4 families in one, living together in one big house uh, or compound, no? Assign dining hours for each family as much as possible. Whereas dati, uh, it's good practice sana for all of us to dine together. Alam mo, it's a time for all of us to meet and talk about things, no? Right now, it's not really advisable because of the COVID-19 and because we go in and out of our houses. So each of the household, meron tayong kanya-kanya activities. No? Some of us go to offices, some of us goes to banks, and we each have exposures outside which we don't want to expose other household members. That's why it's very important to do this. For families with very, very large households, please assign dining hours for each immediate family. For example, maximum of 4 to 5 people at a time during dining times, no? And then social distancing. So if pwede, mga 1 chair apart pa rin, no? So there'll be a lot better circulation at the dining areas, open windows if possible, and then we avoid cross contaminations between ourselves. No? In case one is positive, there might be the possibility the others won't get it also. So that's how we try to prevent for very, very big families. And also we avoid common kitchens as much as possible. No? So yun din yung isa na avoid na identify namin with people living in very big households, in big compounds. No? Okay, the people don't see each other for mealtime. However, they have common kitchens. They have common kitchens. They have 1 or 2 people preparing the food for all the families. And the 1 or 2 people preparing the food for the families are the carriers. So sila yung COVID positive patients. And then suddenly everyone in the whole compound is also infected. So avoid common kitchens if possible. Kindly each family prepare your own food. If cannot be helped, the one preparing the food and the kitchen helper should all be wearing masks and wash hands always, no? Because food preparation is very important, no? Especially like those in the restaurants also, no? So it's good hygiene and good practice, no? I know it's very hot, no? It's very hard to cook with mask, but they have no choice. It's part of precautions right now, no? And for health protocols, no? For the food, for the ones preparing the foods to be wearing masks always, no? And washing their hands always. Please sanitize all packages you receive. UV preferably, no? Get those UV boxes, big UV boxes, UV everything, no? Lahat ng Lazada, Shopee, deliveries, no? And your newspapers, no? I have some senior patients who swear, and I also know that their families are very, very careful. They never went out of the house. However, they only read the newspapers every day. So from that time on, I also UV my newspapers every morning. So because we know that COVID-19 infection virus could also live in fomites or things. No, they could live in things for months. In fact, so we should be very careful also with all the things we touch. Food deliveries should be reheated. So wala namang problema sa food you order outside, no? As long as it's heated. patay na yung virus, no? Kung meron man. So that's a good way to prevent. And also the receiver, the one your maids receiving the packages, don't forget to make them wear masks and wash hands every time they receive packages. Okay, practical tips for the workplace, no? These we found useful. All employees, we advise them to be vaccinated. Encourage their families to be vaccinated also. This is easier said than done. I know that there is a lot of vaccine hesitancy among people outside, no? Especially sad to say for those belonging to the lower educational attainment, no lower income bracket, the more vaccine hesitancy they have, probably because of we cannot um, fault them because probably they have some sad experiences or very bad experiences in the past. No, one is the Dengvaxia scandal. No, their children were forced to receive the Dengvaxia vaccine, and after no, with all the bad media that came out, no, so they were afraid. No, so how to address vaccine hesitancy? This I've tried and tested. In fact, in a school, in a Chinese school, I was invited to talk about COVID vaccination. That time for adults, no, because the school wanted the employees, no, they facilitated already with the Chamber of Commerce to have all the employees vaccinated. However, out of 64 employees, less than 12 signed up to be vaccinated. No, that is during the start of the vaccination program in the Philippines. No, so what the principal did, Doctor, can you talk to the people? So okay, I spent time. I did the Zoom lecture for the staff, and luckily after the lecture, no, mas nag-open minded yung mga people, and they know more facts na no, the reason why people are afraid to get a vaccine is really a lot of they have a lot of questions or queries or concerns that were not answered. No? So nobody bothered to answer the question. So syempre, they don't feel comfortable. If they don't feel comfortable, then why will I accept a vaccine to be injected on me or my family if I don't know enough about the vaccine? No? So after talking to them about it, more than 90% signed up already to have the vaccination, and they eventually all did. And luckily, few months after into the pandemic, a lot of their school staff were also infected, but they had mild disease, no, and a lot were improved at home and treated at home properly. So wala nang na-admit sa kanila. So it's a good thing. So that's how we address vaccine hesitancy. The same thing also for my own employees, no? So in our shop, in a small shop, so 15 employees. Out of the 15 employees, initially nobody wants to get vaccinated, and then hindi ko sila tinigilan, no? Every week, I talk to them bits and pieces, no? Why don't you get the vaccines? The vaccines are available already. So if you want, I could try to facilitate for you. If you want, I could accommodate, accompany you to the vaccine sites even. No? So we did it batch per batch. No, for the 15 persons. Initially, only 2 people agreed to have the vaccines, no? So out of the 15, so 2 people came in, no? So we went for the vaccination. After the 2 people came back to the office, so the other people, so they are okay. Okay naman sila eh. Wala naman masyado side effect, di ba? So during the time they got Sinovac, no? So a few weeks after, so 2 by 2 by 2 by pairs, no? Until all of the 15 are eventually all done. So now I'm trying to get them to get their boosters already, as well as their families. I think most of their families are also vaccinated already. No, so in that case, if you protect your employees and their families, more or less, they come into the office, mas safe ka, di ba? So because you know, if the people are vaccinated, they also transmit the disease less. Did you know that? In case na maging carrier siya of the virus, they got infected, they also transmit less. They have lower viral loads, no? So because of the immunity already. So mas less transmissible, mas less na magkahalat yung infection sa employees and to you, the owner, no? So that's how important it is to get our vaccines, employees vaccinated, and your customers. No? If you're in the food business like us, di ba, your customers will feel more safe if your employees are fully vaccinated and you get the safety seal from the LGU that your staff is all fully vaccinated. No, even groceries did that. So for sick employees, my policy in our workplace, no sick employee should come to work. No, so in case kahit ubo-sipon lang, even cough and colds, no, they stay at home. Call HR. No, do not come in for work. If you get your first aid at home, if still not okay by third day, then get a swab. No, they need a negative RT-PCR before they could come to work. If they got sick. So that is to protect everyone in the workplace, no? Especially mga buntis, mga pregnant, and mga elderly co-employees in the workplace. No? If possible, assign shuttles. No? We find it very helpful also to have our own shuttles for our own employees. No? A little bit cost incurred by the company. However, it will really assure your safety because mahirap eh. They might catch an infection during public transportation, no? In LRT planes or in the buses outside. So because of crowding. So social distancing in the offices is very important. Wearing of masks, the air purifiers. Air purifiers, you have those in the office spaces kung air conditioned siya. Maintain good ventilation either by opening your windows or keeping those purifiers at work. UV sanitation every day after work. That will kill the COVID-19 virus in the workplace. So for diagnosing COVID-19 infection, anyone who is sick, even with mild symptoms, should immediately self-isolate. This is very important. Remind all of them in the house, magkulong po sila in a room. If they don't have rooms, as much as possible, meron akong patient, natulog na lang siya sa garahe, in their garage, no? For 2 days, self-sacrifice, no? Because he also does not want to infect his family members, no? Or find somewhere where you could self-isolate, no? After 3 days, if not okay, go in for swab. That's a gold standard always to do RT-PCR swabs. If not, at least a COVID antigen nasal swab, not the saliva swab at this time, not the saliva test at this time. So for the updated isolation period, there is current change by the DOH regarding quarantine protocol. For probable case or those with mild case of COVID-19 and patients are fully vaccinated, it's now quarantine of at least 7 days from the onset of symptoms. For me, I base it on the date of positive test. So pag nag-refer sa akin ng patient, I always base it on their positive swab result if they have one. No, so isolation, I count day 1 from the swab positive day. That is to keep everyone in the household a bit safer. For partially vaccinated or those with only 1 dose or unvaccinated, 10 days quarantine. Asymptomatic, same, 7 days, 10 days for unvaccinated. Moderate case, you need 10 days. Paano masasabi na moderate case, no? Moderate case are those after 1 week, they still have signs and symptoms, no? They still have medyo sobrang productive cough, they still having on and off fever, then I classify the patient as a moderate case. So that is 10 days symptoms. For ICU patients or severe critical case na admit sa hospital, 21 days quarantine yon. So ang sick leave niya roughly 1 month, no? Especially for immunocompromised patients also. May mga HIV patients to, mga seniors, elderly, no? So longer quarantine periods. for asymptomatic contact, no? Meaning you got close contact, you went to a party, or you were notified by text na somebody you met at a party or somebody you met in the association meeting tested positive. Kasama mo siya last week in the meeting in the same room, no? So you're considered as a asymptomatic close contact. Wala kang symptoms but you're close contact with the patient. You came in contact with the patient. So if you're a fully vaccinated person, 5 days exposure ka, okay? If you're unvaccinated or partially vaccinated, you have to quarantine yourself for 14 days from your family, your own family and your office. No? So tatawag ka sa office, sorry ma'am, I was in close contact with somebody who was positive, so I have to quarantine for 5 days. No? Most of us are fully vaccinated anyway. So updated testing protocol, still, no, remember, when in doubt, no, when in doubt, may, sabi ko nga even cough codes, fever right now, fever 1 day, sore throat, may cough, may codes. I heard my driver, may cough, may codes, may fever 1 day. I let them test. I let them swab. That's for the protection of my family, no? Myself, my family, my patients, and everyone, including his own household, no? So, ginagawa natin to not only because we're trying to protect ourselves, but mostly we're trying to protect our employees also, no? For the sake of his family also. So, that's very important to do. Testing could be not that expensive naman. No, there are free testing. If you want free testing na fast yung result, in Chinese Gen, we have PhilHealth swab, RT-PCR swab. 24 hours yung result niya. They could just claim it using their PhilHealth numbers, and they pay a very minimal fee. As in, how many pesos lang? No less than 100 pesos. No? So, we have that. In government hospitals, the testing are also free. Pero some hospitals medyo matagal ang result. So, better pa rin to go to a private hospital, faster yung result. No? For antigen test, antigen swab, most swab now cost less than 1,000. No? So, in 1 to 2 hours, may result ka na. So, at least, it's also good enough, no? Fast yung result. But however, remember that for antigen testing, it is only advisable for patients with symptoms. If you are asymptomatic, antigen test might not be accurate, no? Pwede siya mag-negative. A positive test might always be, most likely be positive, especially kung may symptoms ka. I would treat the patients as a positive case. However, if negative siya, but may symptoms, I would still require him to do a RT-PCR later on to confirm kung nag-persist yung signs and symptoms niya. Because pwede pa rin siya positive even if you tested negative for antigen. The only advantage it has is fast results. So, but however, the accuracy, in terms of accuracy, precision, better pa rin syempre si RT-PCR. No? So what is the importance of these protocols for workplace? No, para you know, for leave benefits, no, pag tumawag yung employee mo, how long should I quarantine? How many days sick leave could I avail? No, for PhilHealth reimbursement, for contact tracing. That's why these are important. So what are some of the important things to remember in COVID-19 home care management? Preferably each household should have one isolation room, no? Isolation room, better to use own room, better pa rin if you have own bathroom, no? So, however, not all households meron sariling bathroom yung room, no? So, what to do in case you don't have that? You're using a common restroom, but you want to be isolated in the house and not in the hospital or quarantine facility. What you could do is, okay, the patient would go out, he will go into the bathroom to take a bath, diba? To use the toilet, make him wear a mask if he's using the toilet, if he's taking a bath, no? Before and after use of the toilet, spray Lysol, no, sa toilet. So that will keep the toilet at least a bit safer for the next people who will use the toilet, no? So ganun ginagawa namin. If you could UV the toilet at night, that will be best, no? Kahit 30 minutes or 15 minutes UV. That would be even safer, no? Hydration is very important for sick patients. No, I cannot overemphasize the importance of hydration, especially for young kids. I told you, umaapoy ang lagnat. No, the fever went as high as 39 to 40 degrees. No, so it's very important to hydrate. For adults, 3 liters a day. For young kids, no, teenagers, 2 liters a day. Younger kids, at least 1 liter a day. No, so it's very important to take some electrolytes. Sodium, potassium, no? So ito yung mga Gatorade, Vivalite, Hydrate if you could. Kaya mo, no? Hydrate, coco juice. No? Very important to have your sodium, potassium also, because especially with Omicron, one thing very prominent with it is yung severe sweating niya. No? So you're losing a lot of electrolytes. A lot of patients will call me after 3 days, lupay-pay na siya. Doctor, I cannot move. I feel so weak. My arms are numb, my legs are numb kasi naglo-low potassium na siguro. So don't forget to hydrate, no, electrolytes and a lot of potassium, banana apple, no, buko. So that's rich in potassium. Herbal medications is okay. For home care treatment naman, nasa bahay, first aid. I'm also practicing TCM. I also took courses in traditional Chinese medicine, and I use a lot of herbs also. No, so for natural herbals natin, especially for symptomatic relief like sore throat or cough, no, okay yung mga lagundi, yung mga oregano, pwede may laga. In Chinese, we have mga lianhua tea, we have herbal teas, no? So is it okay to take that? Luya tea, ginger mix, no? So lemongrass, tarragon, no? So those are some mint, no? Lemon mint. So warm tea is very good. For warm tea, warm water, no? So that will relieve the swelling kasi the pamamaga inside the throat, no? And that will make you feel better. How about the suob? No, the suob or the steam inhalation. Okay lang yun. You want mint, you want some saline or some salt, no, steam, okay lang. But with kids, remember, be careful. I don't want them to have first or second degree burns, not too near the steamer or the hot water, no? So with precautions, okay? Antivirals, we use. I've treated so far around 2,000 COVID patients at home. I use a lot of antivirals, immunomodulators, as we call them. Nag-improve naman, especially with the moderate cases to severe cases, no? So we use favipiravir. Arbidol is umenifenovir. Molnupiravir is the new ones from MSD, US. Favi is from China and India. Original Favi is from Japan. That's Avigan, no? Arbidol is from China. So far, these meds helpful siya. However, I cannot share the doses with you because as a healthcare practitioner, I truly believe the first thing in home care management, as I said, if you have symptoms, isolate yourself. In 3 days, if you don't feel well, please have yourself tested. In case you test positive, please call your doctor or your attending physician, because it's very important to take meds and be managed by a licensed physician who will holistic ang approach namin sa patient, you know, we take care of the patients as a whole. I'm sure you as a patient, you also feel more comfortable taking meds and being under the care of somebody knowledgeable, di ba? So, syempre kasi, not all medicines or not all medications are safe for everyone, especially those with underlying pre-existing illnesses, no? So some people have cardiac, some people have kidney problems, some people have liver problems, some children have special problems, no? So before you take any medicine, any antibiotics, any antivirals, unless na you, even herbals, no? Sometimes kasi even herbals, you have to take into consideration a lot of things also. May mga nag-allergies din kasi, no? Some people will develop severe allergies with herbals also, no? So, hindi po herbal siya, safe siya, no? So, that's a misconception that all herbals are safe also. So, case-to-case basis. That's why I said, for everything you want to take, please consult a healthcare professional also. Your vitamin C, your zinc, your vitamin D is also very important. Some of the gadgets which might be useful at this time at home, no, important to have a BP apparatus, BP app to monitor your blood pressure. If you don't know how to measure, hindi ka doctor, hindi ka nurse, hindi ka medtech, then get a digital one, the Omron one. The pulse oximeter, so it's handy to have one to monitor your oxygen sats and heart rate, your oxygen concentrator, especially if you have seniors at home. It's a good buy right now, no? So I got one also for my seniors, no? So sometimes we need oxygen for them, and we don't have to call somebody, look for oxygen tanks. So pag oxygen concentrator, matik na siya. So it's also very helpful. So what are some of the frequently asked questions? Vaccines. Is it safe to get a vaccine? I'm sure by now, most of you already have gotten your vaccines, no? For those who still haven't gotten your vaccines, I could say naman na after vaccinating so many people, no? So we have vaccinated, for teenagers, we have 17 million teens, 12 to 17. So we have already vaccinated around 11 million to 12 million of those population. No? For the Philippines, we have already vaccinated around, sabi nila, 60 million. No? So roughly 40 million more to achieve herd immunity, at least 20 to 30% more, no? 20 to 30 million more people. So right now, they're also considering vaccines for kids. Pretty soon, we will launch the vaccines for 5 to 11-year-old. Standby by end of February. So we're gonna have that. Also, regarding boosters, I told you kanina, why is it important? Because the antibodies go down. It's very important to get the boosters. The earliest time you could get the boosters is 3 months from your second dose. Paano kung nagka-COVID ka? No? So, Doctor, I got COVID. My whole family got COVID. We were exposed to COVID. How soon can I get my boosters? No, you could get your boosters 2 weeks after you had COVID, at least 2 weeks. No, after your family was exposed or after the whole family got COVID, 2 weeks after you could have your COVID boosters if you want. If you don't feel like well enough ka pa, hindi pa malakas yung katawan ko, wait 1 month before you go in for boosters. Why? Because as I told you, you have roughly 3 months immunity after you get COVID-19 infection. No? So you won't be infected right away in 3 months. There's only 3 months, remember. After 3 months, you have to be careful again. No? So for travel, so how safe is it? I traveled with my mom, but be careful when you travel. So keep within your bubble, travel with people that you know are COVID negative, and observe proper health standards, wear your mask, wear your face shields on the plane, wear your air purifiers on the plane. That could help. I'm not very comfortable with long flights yet kasi we know the risk in long flights also, no? So for very short flights naman, okay lang. If you have to travel for long flights, talaga no choice. You have to go to the US, or there's air purifiers na with USB chargers that you could charge on the plane. Be sure to wear one of those. The mask with air purifiers. That will make it a bit safer for you. And wear yung mga PPE na, if you don't want to wear PPE, na fashionable PPE, you could use those Uniqlo jackets, yung waterproof na jackets, na light jackets. Anything waterproof, okay siya. Water resistant. It's good for protection. Can I get COVID again? Yes, you can after 3 months. Do I need the reswab after I catch COVID? No, you don't need to. Both the US CDC as well as the DOH don't require you to. However, some work um, companies, no, wherein they have a lot of employees or food establishments, no, you might be required to do a COVID RT-PCR swab, no. So what if I test positive again? Possible yun, no? Some people, they call me, Doctora, I'm well, it's already my 2 weeks after my infection. However, my swab still testing to be positive, no? So you could ask a certification from your doctor in that case that you tested positive so and so kailan, and then you underwent the required quarantine periods, and then you're presently asymptomatic. So your boss will allow you to go to work. Okay, or travel, no? So in that regard, how long does the symptoms last? As I said, it will depend on your immune system. If your immune system is good and robust, you did all the things I told you to have good immune system, so your symptoms will be shorter, no? So ito yung mga patients who call me, Doctor, I had fever for 1 day, some sore throat. After 2 days, after taking your meds, I'm okay. No, so that's how quick you could recover from the Micron, at least for Micron variant. No, Pedia COVID vaccines, are they safe? So far naman, we have vaccinated a lot of patients already, roughly 11 million, I think. More than 11 million kids already, and we have minor adverse reactions naman so far. Mostly allergic reactions, one or two severe ones, but not admitted naman. They were immediately addressed. May epinephrine on standby naman. That's why I advise you to get your vaccines as much as possible, anybody. For vaccines, no, for vaccinations, whether adult or pedia, I still prefer hospitals. Or hospital setting, or yung marami kang, because in case of emergency, no, baka kulang ang facilities, no, in outside, no, in the schools, in public schools, in ano, medyo choose, if you have to go to a public school, then choose one that's near a medical center, no, in case you have to go to a hospital, no, be on the safe side, no. For pedias, I let all my kids, all my patients get theirs in the hospital setting to make it safer for my patients. So what are some of the DOH approved COVID-19 boosters? All vaccines are available for boosters na maganda combinations, no, so far. For Pfizer, for Astra, you could get Pfizer or Astra. For Janssen, preferably Janssen, if J&J also. If J&J is not available, then you get the other vaccines, whichever is available, at least 2 months after your first dose. Sinovac or CoronaVac, no, prefer to get mRNA, Pfizer or Astra or Moderna for higher antibodies. If you want to stay homologous, get the Sino, no? For that matter, better than nothing, no? It still will give you protection din naman. Moderna, preferred Pfizer, Moderna. So thank you so much. I'm open to accept your questions. You could ask me questions in English, Tagalog, or Chinese. Feel free.
Doctora, thank you very much for the presentation. Before we go to the Q&A portion, I would like to do a 1-minute advertisement lang. Meron kaming isang product na gusto namin ma-introduce sa market, no? And please, I would like to request everyone to please bear on with this presentation.
This is John. He is looking for a trustworthy blood glucose meter. But he is worried about the need to prick finger and blood collection. To suffer with finger pricking pain, the need for expensive lancet devices and test strips. Good news! We can help you. Introducing the world's first inductive non-invasive blood glucose meter, now in the Philippines. The eTouch ETM G01E. The no needle, no blood, no pain, no infection, huge savings. it allows multiple users. Features of ETM-G01E. Now for a special introductory price of 9,999 pesos. To get this one-of-a-kind product, go to our website, thrive.agronomics.ph.
Okay, thank you everyone for your time. So with our Q&A portion, there are a lot of some questions pouring in already. Doctora, allow me to read them for everyone. Meron po dito from Nestor Macorol. Hi po, Doktora, kayo po ba ay nag-recommend ng booster shots? So I think it's obvious in your presentation, Doktora, no, that booster shots are
Happy. Recommend. Yes, it's very important. Why? Because the antibodies start to go down. Theoretically, it should go down by 6 months. However, recent studies will show, international studies are coming in. These are research studies. I'm also a clinical researcher. Based on the studies we've read, if you got sino or 2 coronavac, the antibodies might start to go down by 3 months. No, so since majority of our population were initially given coronavac or Sinovac dati, no, because that was the one widely available in our country during those times. We doctors, we all got almost 90% of us got coronavac, no, because that time wala pa namang Pfizer, walang Moderna. So there was only very few Astra during that time. We were the first batch in the Philippines vaccinated, kami, healthcare workers, no. So all of us, all of our families got coronavac. No, so and then people starting getting infections already. So that's why the DOH also recommended, based on the clinical researches, we have to get boosters at least 3 months after. For those the earliest you could get is as 3 months. If you got sino, please get it after 3 months. We all did already. We all got ours.
Thank you so much, Doctora. There's someone, our friend, Brother Henrico, is asking if is ivermectin effective to treat COVID? What's your opinion about ivermectin?
There's a lot of studies already, both local and international. I know there's a lot of international studies claiming that. No, however, based on the studies we reviewed, ni-review, no? Hindi siya randomized clinical trials kasi most of their studies are anecdotal or based on shared experiences by people who took the meds, no? I personally, I don't either. So, why? Because there are liver precautions, no? Too much of it may cause liver toxicity, no? Especially if already with fatty liver, already with liver problems, no, so hindi siya very advisable for us. And there are other alternatives naman which we could use for prophy. Ako personally, I followed the one in China, in Wuhan, China. They use Arbidol for prophy, so I took Arbidol for me and my family. It's only 6 days. Short course lang kasi siya.
Yes. But Doctora, di ba yung mga some of the people who are taking ivermectin,
for those who are taking, okay, just be sure to monitor your liver enzymes every 6 months. I would recommend. So for those still taking, monitor lang every 6 months or at least yearly. Pero better 6 months, especially for seniors.
Okay, thank you, Doctora. There's a question here that I personally do not understand. What is MIS-C?
MIS-C. MIS-C is multi-inflammatory systemic syndrome, no, from COVID. That's why it's called MIS-C. I shared with you, since the start of the pandemic, I've managed 2,000 patients already. 800 sa Omicron. So 1,070 sa Delta. And then the ones before Delta. No? So I'm a part of a COVA. So Federal Mundo Medical Center is a COVID accepting hospital. It used to be a full COVA. fully COVID siya before, but now they're open now to general cases already. So I see a lot of COVID patients also. Miss C is more common in children, in pediatric populations. Among all those I shared with you, my 2,000 cases, for Delta, I got 60 Delta patients. For Omicron, hindi ko pa nabilang yung actual number. I have no time to do the census. But I would presume, siguro I got hundreds na for pediatric cases this year. Kasi each family have 2 or 3 children di ba? My youngest is 2 months old. But for Micron, luckily they're mild. No? So aside from the fever, they're all okay with antibiotics. I did not admit any of my children this year. For the Delta, I had severe ones. So yun yung missy ko. Multiple inflammatory system, meaning the most common COVID complication is still pneumonia, COVID pneumonia, di ba? So my youngest patient that I admitted was 9-year-old. I had 3 admissions that year. One is a 9-year-old kid, one is a 15-year-old kid, one is, forgot the age of that one, but a teenager also. So I had 2 teenage patients and 1 9-year-old patient. No, I had 1 septic 1-month-old patient, no, all Delta. So that was during the Delta time. The 15-year-old, nahirapan na akong buhayin siya. It was a close call. The patient was an only child.
The child
It was also
survived?
it was also very traumatic for me because I was under a lot of pressure. Imagine a patient, a 15-year-old. This was not my patient. It was somebody referred to me. So I did not know the history of the patient to begin with. So I just managed a patient as home care. Eventually, when I saw the patient is not getting well, I convinced the mother to have the child admitted already. So I admitted the patient already at FE. The patient had remdesivir IV and a lot of IV antibiotics. I went as high as meropenem because the pneumonia of that patient was really bad. The patient was almost intubated. She had cardiac complications. Yun yung MIS-C. Yun yung multiple inflammatory. No? So aside from the lung complication, the heart, she had severe VM, viral myocarditis, to the point that the heart rate became 50. The normal heart rate of adult is 60 to 100. So it was really bad. We thought we're gonna lose that patient. So talaga a lot of dasal na and a lot of management went into that case. It was a close call. No vaccines yet at that time. So this patient did not have any vaccination kasi. So that was the time I decided to volunteer for the first COVID pediatric vaccines. That's why I volunteered for Pedia COVID vaccination program. I started vaccinating kids 15 to 17-year-old because of that patient also, which we see a lot of patients dying na teenagers. But, they're 15, they're 16, 17. When you take a look at the PIDSP, Philippine Infectious Disease Society census, we have 8 to 9% mortality, no, in that age group alone for teenagers. No, very close call siya. That's why I said the vaccination is very, very important for that older teens, 15 to 17. For younger kids, medyo safe pa eh. Sa younger kids, they're usually milder, no, usually. Unlike yung 9-year-old ko. Di ba, yung 9-year-old ko also severe. But he was asthmatic. He was my patient since premature baby. He was a second of twin who was left in a healthcare center. I call him a shoebox baby. Could you imagine the shoebox? He fitted the shoebox. He was born, yes, he was one of my miracle babies. The patient was an abandoned kid, abandoned fetus, abandoned infant in a healthcare center. So inadapt lang siya ng isang good Samaritan. So who eventually became his parents. So that patient was under my care since baby. So shoebox baby, nabuhay siya until ngayon, 9-year-old na siya. He had severe COVID. He was infected from his family. But luckily, we were able to tide him too also.
Thank you, Doctora. There's someone who's asking, there are recent studies by DOST that VCO was able to help make the symptoms mild, no? What can you say about VCO, Doctora?
Unfortunately, yung study trial, kung i-base mo sa international standards, baka hindi siya masyadong pumasa. Kasi what they did was they enrolled patients at the quarantine centers. May mga probable COVID, may mga COVID na talaga, no? Dapat in-enroll nila yung all COVIDs lang. Kasi paano kung probable COVID lang siya, hindi naman talaga siya COVID. Tapos idim VCO, i-hockey, gumaling siya. So, pero I have nothing against VCO. In fact, I agree. Okay lang sa akin kasi VCO wala namang payhay so far, ha. It's virgin coconut oil. I've done a lot of clinical trials using VCO and MCTs kasi. Even for my newborns, I once did a baby trial. Nag-massage kami ng VCO on septic newborns, yung mga babies may infections at the nursery. So they lived longer and they were able to go home at the nursery, faster recovery than those we did not give VCO. So okay lang sa akin na VCO. I have no, if you want to take, it's good to take it regularly also kasi it helps correct our bad cholesterol also. Diba? May good effect siya sa body eh. Tapos your liver, no, keep it healthy also. You could drink 1 teaspoon BCO a day, pero for me, like people like me, I don't like to drink it. I halo it in my food. So if you want, you could halo it as salad dressing, diba? Halo it instead of using your olive oil. You could use it as with a few drops of balsamic vinegar and you put it on your salads. If you don't want to drink it, no? Diba? Or put it in your porridge sa lugaw or put it in the oatmeal, no? For my babies na for weight gain, yung mga newborn baby na preterm like the shoebox baby, I was telling you shoebox siya, diba? So how do we build the weight for these babies? We give BCO. So we use BCO a lot in the nurseries. So no harm, pwede naman i-take. I agree with BCO.
Thank you, Doctora. I know
may anti-staph and antiviral properties ang BCO also.
Yes, I know, Doctora, that yung active ingredient sa BCO is that when we ingest BCO, our body metabolize it into what they call as monolaurin.
Yes.
So meron din kasi sa market ng mga monolaurin supplements.
Yung laurin kasi is medium chain fatty acid siya. In fact, it's used widely in Taiwan also. As I told you, also in the nursery, in the NICU, in the nursery ICU, for weight gain ng babies. No? And anti-staphylococcal properties, antibacterial properties, antiviral and all. But I told you kanina, di ba, based on my course sa Stanford, which I studied nutrition, mas na-absorb ang food, ang nutrients or vitamins pa if it's in a natural form kesa dun sa mga capsules and oil supplements na. So if you could take the liquid ones, I think that would be better pa than those capsules and herbal capsules or so other supplements. It might be better to take the liquid one.
Yes. Doctora, thank you. There's someone, Pastor David, is asking about Lianhua capsules, which is quite popular among the Chinese. And,
it's part of the herbals I use for my patients. For mild cases, nagwo-work naman si Lianhua capsules, no? However, with Lianhua capsules, as I mentioned kanina, yung mga may severe allergies, you have to be careful lang. So it might trigger some allergic reactions lang. So mag-standby lang naman antihistamine. So mga people I know I have one patient, very severe allergy siya. Walang pwede sa kanya antibiotic and all. So very hard to let him take meds, di ba? So pag magpapatake ako sa kanya meds, I have to make sure na may naka-standby in case you develop allergic reactions, you do this, okay? You take this anti-allergy kaagad. Tapos I started with low dose. So instead of the full 4 dose capsules, 4 capsules kasi siya, di ba, per Q8, so every 8 hours. So I started with low dose, 2 capsules lang muna for that patient. So that's why I said very important yung healthcare practitioner to monitor you each case naman, di ba? So Parlaw lang, minsan ganun din ako. Pag hindi niya kaya yung full dose, nagtitaper ako or lower dose. Kasi some people, especially those with chronic kidney problems and chronic liver problems and very seniors, 98 yung pinakamatanda kong pasyente eh. No? So sometimes I have to titrate some medicines for them.
Oh, okay, Doctora, there's a question here that just said that when you get COVID, na meron tayong parang 3 months of natural immunity.
Yes.
And ito bang immunity ba nito para sa lahat ng variants?
So far, what we could see, I have yet to know in all my patients, wala pa naman ako nakilala who developed in less than 3 months. So mukhang covered naman siya, even nung Delta.
So dito sa Pilipinas, is it ang predominant na ba tayo sa Omicron?
Looks like.
Meron na ba
Kasi
tayong
based on the cases, unfortunately sa bansa natin, we don't have genotyping tawag dun eh, no? Yung we genotype the variants or the cases, no? I told you nga how many people lang nagpapa-RT-PCR eh, di ba? Marami, they even do antigens at home, you know that, di ba? So, how can we test the variants outside? I base it on the clinical presentations. Kasi yung clinical signs and symptoms ng mga patients ngayon calling, most likely they're all Omicron. Kasi light lang yung symptoms eh. Eh yung mga Delta, di ba? Severe yung symptoms nila. So, makikita mo yung difference. There's a difference in terms of the clinical manifestations sa tawag namin dyan. Yes. So more of Omicron right now. But we cannot say, di ba, in other countries, in the European countries, they're saying, nag-mutate na uli. They have a new variant now. I forgot the name they called. They called it according to a center that first identified the variant. There's a new variant coming in. So, sooner or later, every 5-6 months down the road, there will be newer variants. It's non-stop. So, wala naman talaga siya. That's why it's very important take-home message mo. Continuous dapat yung health protocols. Kaya nag-surge siya noong December kasi the people became lax. We became lenient. Pinalabas ng IATF yung mga unvaccinated bata sa malls, which is really bad choice, no? Because the kids yung naging carrier eh. In most of my families, 80 families I got, the first ones who got sick was the kids. So na-infect na lang si ama, si angkong, si lolo, si lola, si daddy, mommy. But the first one who got sick in the families are the kids who went to the malls.
Wow. Doktora, based on your experience, may nagtatanong
because unvaccinated sila.
Yes, I think this is related to this question. How many % do you think ang mga tinamaan in terms of the vaccinated versus the unvaccinated? Mas marami ba yung mga unvaccinated?
No, it's the same. Same yung unvaccinated sa vaccinated in terms of number. I would say in NCR kasi, we have actually good vaccination coverage na eh. In NCR, according to the last data na DOH, if I remember it right, roughly 70% were already vaccinated. 60%, almost all vaccinated na tayo eh, with 2 doses already. Most of us, corona lang nga nung una, di ba? So, konti lang yung mga nag-mRNA. Nitong recently lang, this year lang naging available yung mRNA, last quarter. So, most of us had the coronavac. But 70% of NCR is already vaccinated. No, so most of those who got COVID this year, pareho lang eh, no? Vaccinated sa unvaccinated. Kaya lang, yung mga nasa ICU, yung mga told you, in the ICU now, admitted in the hospitals now, are unvaccinated. Most of the vaccinated in the homes lang. Sila lang, okay na ako eh. Diba? They will call me, Doctor, we're COVID negative na after 1 week, thank you. So most of them improve fast, no? Fast lang yung improvement, and they improve in the house lang, hindi sila admitted. Unlike those unvaccinated, they are the ones in the hospitals now.
Yes.
Yung mga children, kaya maraming children admitted because they are unvaccinated yet.
Doctora, will it be okay that we can share your contact details sa group if they have
Sure.
questions or they request
Pwede naman i-consult. You could contact me.
Yes. So I'll post your number dito po sa sa chat, group chat, no?
Okay. What are some
So
ailments
is there any other questions? Please feel free, no?
what
Uh,
are some ointments, ano?
that should avoid vaccination. Ano ba yung mga sakit mo? Siguro
So
predispositions.
far, everyone is allowed naman vaccinations, including immune-compromised patients. In fact, I've known of institutions, yung mga HIV patients sila, HIV carriers. So, inallow din sila to undergo vaccinations. But I always tell patients, if you know, gising ko kalam seniors, young kids, bata, choose a healthcare facility. Do not go to those. Mag-open na sila in drugstores, ha? I have nothing against. Sorry, ha? I know the government is trying to fast track kasi the vaccination program. No, kasi to improve the coverage nationwide, they have to, they're gonna open in Watson's, they're gonna open in Mercury, they're gonna open in Bose Pharmacy, in the, lalo in Swatian kasi baka there are not enough public schools or hospitals wherein they could have their vaccination programs, no? So, pero if you have a choice, and alam mo naman may medical concerns ka, they don't allow you din most, LGU, mahigpit sila eh. Pag alam nilang may hyperthyroid ka nga, yung maid ko ngang goiter, ayaw bakunahan sa school eh. They want her to go to a hospital kasi alam na may severe allergies siya. So if you know you have those conditions, you have to choose a medical facility, please. Safe naman yung most medical facilities. Like in Chaijen, they have their vaccination center doon sa medical campus. Hindi naman siya sa hospital eh. But if you are immune compromised, get your clearance first from your doctor. If you have cardiac condition, paalam ka muna sa cardiac doctor mo. So your cardiac doctor, your doctor will know your condition. Kung alibay yung mga naka-cancer, chemotherapy, kung pwede ka na magpa-vaccine now or not. Severe asthmatics, pwede ka na ba magpa-vaccine now or not? Kasi i-quantising ko din na kaya na ng katawan mo ngayon or not. 'Di ba? Kasi kung low yung kung HIV ka, kung low yung CDC rate mo, kung cancer patient ka, very low yung what you call this, yung mga leukocyte count mo, lymphocyte counts natin, no? They won't let you go in for vaccination muna. They will let you wait, no? But if your doctor cleared you to be vaccinated, then by all means choose a medical facility. Ayun yung about cancer patients. Yun.
Okay, Doctora, there's a new question here from from Zenith United. A pleasant good afternoon, everyone. Doctora Wong, tanong ko lang po, gaano po tayong katiyak ng isang taong nag-positive pagkatapos ng quarantine ay hindi na makakapanghawa pa ng iba dahil sa na di na siya
unfortunately, the reason why they scrapped the repeat RT-PCR was based on a Korean study, tsaka sa US, tsaka dito din, nakita din namin, a lot of patients are still testing positive after 2 weeks. Lalo na yung mga severe patients. This was during the time na unvaccinated pa yung patients. They don't have any vaccine doses yet, any COVID vaccine yet. So wala siya antibodies. So the viral load, pag wala kang vaccine, yun yung sinasabi ko kanina sa'yo, a person who is already vaccinated, kahit infected siya, yung viral load niya kakela, mas slower yung viral load niya. So mas less din niya matatransmit sa coworkers niya and kasama niya. Halimbawa, nakasama mo siya sa jeepney or nakasama mo siya sa office, close contact ka, pero baka not very sure na positive siya, mahawa niya lahat sa office, kahit aircon, kasi the viral load of that person who already is vaccinated will be lower. Lower yung virus load niya eh. Ang ibig sabihin ng virus load, virus count. So, sabihin mo na isang tao, unvaccinated, ang virus count niya 4,000. Pero yung isang vaccinated, ang virus load niya 500 lang. Very low na. Kasi meron na siya antibodies din in her body eh. Meron na siyang vaccines. No? So, her antibodies kept the virus lower minimum na. So 500. So 500, not very likely also to infect everybody in the office. However, yung itong 7 days quarantine na to, is a new recommendation na naman ng IATF. Very new lang to. It came out during the surge. In fact, nagalit ang mga healthcare workers dyan. Yung sa isang slide na na-share ko, I don't know kung ano yung point niya na meron pa siyang quarantine for general population, if you notice, and general quarantine for healthcare professionals. Kasi iba ang healthcare professionals, kachodit ang quarantine namin. Noong una, ngayon ginawang same na. Kasi umalma yung mga healthcare workers eh. They want us to have 5-day quarantine only if you have mild symptoms instead of 7 days. Kasi fully vaccinated naman kami. And healthcare worker naman kami. Sabi namin, healthcare worker, silang ba? Tao din kami, hindi kami Autobots. We're not machines. And the healthcare worker now is working non-stop overwork, especially nung New Year break, yung surge, no? Most healthcare workers now are really tired and they're really sick also. PGH, more than 200 nag-positive. In a hospital, more than 600 naka-quarantine. Ang Chinese Chen, nag-close ang OPD namin because naubos din ng IM residents namin, na-infect lahat. No? So, that happens in hospitals kasi the healthcare workers' immune system low already because you're very tired. You don't get enough sleep, and then the workload is so much already. No, so syempre hindi din your immune system will not be functioning okay also, no? And then they lowered the quarantine days. And then they even made it 0 days for healthcare worker. Imagine 0 days ha. Pag close contact ka pero fully vaccinated ka and the healthcare worker ka, no need to quarantine. Doon nagalit yung healthcare workers. A PGH, sige ko, we will not follow that. Hindi sila follow. They observe for the 7 days quarantine also. So, and then other hospitals already, the Nurses Association, so like kung we are not in favor of what the DOH wanted us to follow, na 0 days quarantine, di ba? Kasi it's not safe for patients, it's not safe for our families, it's not safe for the healthcare worker. Paano kung namatay siya, di ba? So, kahit nasabi ko, mild si Omicron, but still, with the immune-compromised person, you could have very severe infections. Pwede ka pa rin mamatay, di ba? So, kahit mild siya, boy, anti-E pa rin. So, that's very important also. Your immune system should be good. No? So, itong 7 days niyang bago, it used to be 14 days eh. It used to be 14 days. For me, ito palang nakikita ako palang now kasi bago lang ni-launch tong 7 days quarantine na to. I have one patient. Unfortunately, employee din namin siya. So mabuti employee namin siya. So alam ko, na-monitor ko siya kaagad. She told me kaagad she got sick. So 4 days, I asked her to get a swab. She's a breastfeeding mother, may young newborn. So positive siya ngayon. I'm treating her now. She was exposed to coworkers na 7 days quarantine. Dineclare na, bumalik na sa office. Kaso umuubo pa raw. So, hindi ko rin technically masabi kung, diba, if she got infected by that coworker, but it's my first case so far this year. Na somebody was infected by somebody close contact na 7 days quarantine, 7 days treated. Sent home 7 days treated. Pero apparently, negative antigen na yung taong kasama niya. Ha? So those 2 workers, ni-require din ng company na negative antigen test. But still, wala siyang ma-identify na ibang contact. So I don't know yet with the 7-day quarantine. Kaya personally, for my own patients, lanang patients lalo, yung mga maraming tao sa household, I ask them to kulong for 10 days. Also, hindi ko masyado sinusunod yung 7 days for safety ng household. I still prefer the 10-day quarantine. Feeling ko safe lang.
Thank you, Doktora.
Pero yung retest, no need na talaga to retest. Yung 14 days from 14 days, talaga no need to swab na. Kasi safe na safe ka na by 14 days.
Doktora, may question po dito. Someone who has psoriasis na disease,
Skin disease. Pwede naman.
nakapag COVID na rin siya ng
Mm.
ng 2 shots. Pwede ba siya mag-take
And
ng booster
booster.
shot? Yes.
Yeah, oo, kasi naka 2 shots ka na eh. So kung nag-okay naman siya with 2 shots, no major reactions, that means you are safe to get your boosters. Pero just the same, sabi ko nga, always go to a medical facility kasi sa medical facility may allergologist kami on standby in case you develop allergies.
Okay, so Doktora, malapit na pong 5 o'clock. So maybe let's ask if there are any other last questions from the floor, so that otherwise we can close our seminar for today.
Most accurate tests to recommend, RT-PCR, syempre ang good standard.
Yes. Okay, thank you, Doktora. So before we close, I would like to invite everyone na meron din kaming isang very interesting topic. Next week, kilala niyo ito, Doktora, si Dr. Tan Cho Cheong sa katapusan ng buwan. This is a very interesting topic, lalo na sa aming mga seniors, no, na meron na kaming konting dementia. So the title of this seminar will be How to Have a Happy and Healthy Brain. No, so please keep in touch. We're going to post this link as well as invitation to everyone for next week. So with this, if there's no other questions from the floor, maybe we can bring our medical seminar to a close, no? So may I request Pastor David, if you're around, can you please give us a closing prayer?
Okay. So first of all, I'd like to thank Dr. Jennie for the very nice interaction that we have. It adds knowledge to our common mind of how we could protect ourselves, no, against the Omicron and whatever future variants na pwede pang lumabas, no. So it's very informative. I'd like to thank you for that. So let us now close the meeting with a prayer, and we ask for protection and guidance from our Almighty Father. Let us pray. Yes. Our Heavenly Father, we thank you for this wonderful opportunity that we have gathered all of us into this very interesting seminar and workshop, so that we will be able to have extensive knowledge in how we could protect ourselves and our families as well as our workers in the office. Thank you so much, Father, for the inspiration that you have given us through Doctora, that we will be able to finally have the many answers to the questions that has been lingering in our mind. Thank you for the clarity also, and then the steps that we are to undertake in order we will be able to protect our family and our friends. Father, I pray also for everybody who attended, and to extend also to their families, that you continue to protect them, you continue to shower your blessings upon them as they move around within our country, Father, as they go to work, go to school, and do other chores. Father, thank you through your divine protection that we remain always protected. And for those who are, unfortunately, that are infected with the COVID variant of Omicron, Father, we ask for your divine healing, that you will heal them, that you will uplift their lives so that they will go back to the normalcy and be with the family. Thank you so much again for this opportunity. Na mahigit sa lahat, Father, we ask you to continue to bless our dear Doctora Jennie, she and her family, to keep her safe, give her the strength, give her the vitality that she would continue to be serving to a lot of patients who needs her services. Thank you, Father, for her participation with us. Thank you so much, Father, for everything that you have given us. All this we pray in the mighty name of your Son, Jesus Christ, Yeshua HaMashiach, our Lord and Savior and the coming King. Amen and amen. Thank you so much. Brother Dan?
Thank you. Yes, thank you so much, Pastor David, for the closing prayer. So at this point, I would like to say thank you, everyone, for your time and for listening to our seminar. Let us also thank Doctora for her time in sharing valuable knowledge to everyone. So with this, I would like to say may God bless you all, and have a nice weekend rather this Sunday evening.
Thank you.
So thank you very much, and goodbye, everyone.
Happy New Year.
Yes, Happy Chinese New Year.
Happy Chinese New Year.
Yes, okay. Thank you, thank you, thank you.
This country has faced so many problems since the start of 2020. So why AgriPortal? 1. To solve our food problem. Our government's poor management of farm produce have resulted in either oversupply that leads to wastage, or undersupply that leads to skyrocket farm prices. With special thanks to these greedy middlemen, we have a problem. Our solution: we will bring the market to the farm, through project harvests. We will connect the buyers, processors, and end users to farmers' communities. To solve our present food problem. 2. To transform the mindsets of our farmers and less fortunate Filipinos. Presently, we live with a wrong mindset. This is the main reason why farmers continue to live below poverty line. They do not know their basic ABC, attitude, behavior, and character. Our solution, our Stewardship Quotient program, is designed to transform our stakeholders and farm communities. Morally, behaviorally, financially. 3. To motivate the youth and women to get involved. Presently, our youth and women are neglected, while our farmers are getting old. Our solution: let us empower our youth and women to get involved in agriculture, environment, ecotourism, and agribusiness. Women in agriculture surpasses the men. Let us equip our youth, for they are the hope of our future. 4. To form faith-based communities to become agri-enterprises. Because of agrarian reforms, farmers are fragmented and vulnerable to abuses of the rich merchants. Our solution: we shall incubate faith-based farmer communities and faith-based investor communities, then design pilot projects for them, to become independent agri-enterprises of various sizes and capacities, supported by featured services of AgriPortal, for them to thrive and grow, that one day soon, they will achieve their dreams and aspirations. 5. To resurrect agriculture and make money. Our solution: as we solve the food problem, educate and change the mindset of Filipinos, empower the women and the youth, and forming faith-based communities to become agri-enterprises all over the provinces. This would guarantee not only a resurrection, but a genuine transformation of our hearts of the nation. As we look forward seeing our vision fulfilled and completing our mission, reaping the benefits of transformed hearts of the nation, as our stakeholders become true stewards of God's resources, prosperous families bound by love, productive and inclusive communities, a blessed and fruitful nation, blessing to all nations. Let's work together to make this noble advocacy a reality. For our children and for future generations. AgriPortal, transformation in the hearts of the nation. Thank you for watching.
Okay, thank you so much, Pastor David, for the video clip. So again, thank you everyone, and have a nice Sunday evening ahead. So see you again next week for a very